In the hilly areas of Kabong district, health centers are far apart and hard to reach. Because of this, many women give birth at home assisted by traditional birth attendants, TBAs. These women, despite lacking formal training, have been indispensable in safeguarding maternal and neonatal health in each community. Among the many traditional birth attendants operating in the district, this 53-year-old woman, who we will call Maria Lomeri in Tim Sub-County, stands out for her 13 years of dedicated service. Though uneducated and uncertified, she's a cornerstone of her village's healthcare system, drawing from ancestral knowledge passed down through generations. In her modest homestead, she's surrounded by rudimentary tools and time-worn herbal remedies bequeathed to her by her late mother.
My mother died when she was 78 years old. I took over from her. Before she passed, she called me close and said, "All of this is now yours. If an adult or child comes with labor pains or a toothache, you are responsible."
Lomeri's work includes routine examinations for pregnant women to assess fetal positioning. She says if the situation proves too complex or risky, she refers the mother to a health facility without delay.
I feel the womb, and if I sense distress, I provide a herbal remedy. Whether the woman accepts it or not, I tell her it is available and often the pain disappears.
Lomeri says she uses gloves and masks from the health center to prevent infections. However, the last time she got a box of gloves was last year.
I can often tell by looking at a girl's face if she will deliver safely. Last year, I helped over 22 women who went into labor while on the road. I delivered them safely.
She candidly admits facing tough cases in the past, such as obstructed labor. Without access to medical tools, she employs a ring-shaped object to aid dilation.
Sometimes I cut the woman's private part so that the baby can pass through. After delivery, I do not stitch the cut. I let it heal by itself. If a woman comes to me with labor pains and I do not have gloves, I cannot turn her away. I use my bare hands because at that point, saving a life matters more than wearing gloves. I first wash my hands before I attend to the mother.
Dr. Sharif Nalibe, the district health officer, acknowledges the crucial role traditional birth attendants play in maternal care, especially among the IC where insecurity and poor road infrastructure hinders access to medical facilities.
We have encouraged the TBAs to escort the mothers to the facility, so that within the facility they be there like an attendant and they observe how we safely deliver these mothers. But I can tell you still, the TBAs, we still have them and they are still operating, despite us discouraging the community from using these TBAs.
Beyond childbirth, Lomeri is revered as the village dentist. With a hook, sharpened with a stone and sanitized by rubbing soil on it, she extracts teeth and applies herbal remedies to stop bleeding and relieve pain.
I clean and dry my tools after every use, and thankfully I've never encountered a case of infection. My dental services, especially for children, are in high demand.
Her challenges, however, are significant. During the dry season, medicinal herbs become scarce. In the rainy season, the herbs are difficult to dry and preserve. Lomeri calls for government intervention in the form of gloves and masks to enable her to serve her community safely. She also pleads with the government to provide her with modern tools to extract teeth.
If the government could train us, especially for childbirth, we could save more mothers. Several women I have helped might not be alive today if I had not been there. I also need some drugs such as eye ointments and dressings.
According to the World Health Organization, as long as women give birth without the assistance of a trained birth attendant, training traditional birth attendants will provide the potential to decrease maternal and child mortality and morbidity.
Low light, but not stable.
The training will dispel ignorance, decrease harmful ritual practices, and promote safe practices and use of the modern healthcare system.